Good morning, everyone. I hope everyone's getting settled in all right. Thank you for joining us today. Welcome to the RHP7 Stakeholder Forum. I'm Katie Coburn, manager of the Regional Healthcare Partnership 7 at Central Health, Region 7's anchor. So I'm honored to be here with all of you today. I hope you enjoyed the video. I know it was quiet, but I'm going to use that as a teaser to go visit Region 7's new website. You can see it here at the bottom left of the screen, texasrhp7.org. That video is featured prominently along with other videos about the good work of the DSRIP projects here, so definitely check that out if you haven't had a chance. I'm really excited to see everyone here as we end the fourth year of the 1115 waivers, 5 years. And as your projects are progressing, you're really starting to see results, and I know how hard you've worked to achieve this. And so this morning, we're going to highlight and celebrate a lot of those results. I want to give you a couple of examples to start off. Austin Travis County Integral Care, one of your DSRIP providers here, through the 1115 waiver, expanded the scope of its mobile crisis outreach services to increase access to 24/7 psychiatric crisis care. Now they're able to co-respond with local law enforcement and other first responders like EMS. And as a result, Austin Police Department data are reporting a 39% drop in mental health related arrests. A significant achievement that requires partnerships both within and outside healthcare. Another success I want to highlight, you can see a flyer in the center of your table. The Community Care Collaborative just this week launched a new community resource directory in partnership with Aunt Bertha. You all may remember the CEO of Aunt Bertha spoke at this meeting last year to talk about how technology can help engage patients in their care. This new living directory can connect people who navigate patients across organizations. And the users of the system can suggest updates to make sure the information is current at all times. So this is a real accomplishment for our community. If you want to know more, want to become a registered user, pick up one of those flyers. Later this morning, we're going to hear about more DSRIP successes. We have a panel of your DSRIP colleagues that are going to speak. But first, I want to highlight the other theme of our discussion today. We're talking about culture change, creating a culture of patient engagement. And this culture shift is paramount, and we're going to look at it from a couple of different angles. Stacy Chang is here from the UT Austin Design Institute for Health to talk about applying design thinking to our patient engagement work. Mark Hernandez of the Community Care Collaborative is also going to offer his experiences in creating culture change among health providers in our community. So it's my hope that these ideas that you'll hear will inspire ways for you to even further enhance your patient engagement work at your organizations. We're also honored later this morning to have Lisa Kirsch from the Texas Health and Human Services Commission to talk to us about the status of the 1115 waiver renewal process, which is going on right now. I know sustainability and what happens after October 2016 is on everyone's mind, so we'll have a preview there. And as we spend the day sharing the highlights of our work here, I'd like to encourage you all to tweet out photos, ideas, thoughts, experiences. You can follow and retweet us. We'll be doing that at Central Texas. You can see it there. Please use the hashtag RHP7 so we can all, I'm not on Twitter, so y'all can, whatever it is y'all do it. That'd be great. But now to start our program, I would like to welcome to the podium Central Health's President and CEO, Trish Young-Brown.
Thanks, Katie. And I don't tweet either. You should have heard the conversation I was having with Mike McKinnon yesterday about Central Health's Twitter account and should I have one or should I not have one? He wisely recommended that I just kind of hold off on that, that there might be a grander plan that I could fit into once I was more knowledgeable. So I love my polite diplomatic staff. It is really a blessing to be with y'all today. We're here to pause a moment at the beginning of our meeting to recognize and acknowledge the hard work, the passion, the wisdom, and the caring of our colleagues and friends who are gathered here today. It's really, really fun to see your faces again, to believe that I think it was a year ago we were here, and a year's gone by, and here we are, gathering again. I wanted to recognize a few people that are here with us today. They may not physically be here right now, but I know they will be here later if they're not. I think we will have Amanda Foster from the Office of State Representative Elliot Neistat will be joining us. I noticed David Hart, one of our Community Care Board members, is here with us today. Thanks, David. It's good to see you. I don't know if Barbara Shirley is here. I think she might be later. She's also a Community Care Board member, and we love her commitment and passion to care for our community. David and Shirley both embody that. I believe Frank Rodriguez from the mayor's office will be here today with us, and also Ms. Guadalupe Sosa is here. Thank you for joining us from the Austin Community College Board of Trustees. So we're really glad you're here. I describe the 1115 waiver as our grand adventure, and I do so because it's a grand vision to achieve an integrated, cost-effective health system for our communities. And I believe it's a grand adventure because of the very nature of its impact. I have observed us developing meaningful and I hope lasting collaborations. We've made significant progress towards developing what I refer to as systems of care. I think that's a term that's kind of coming into being. And we're developing those systems of care by knitting together what have been traditionally silos of care. And most importantly, and what we're going to be focusing on today as well, is we've highlighted and focused on patient engagement as a significant key to successfully transforming those systems of care. The amount of work that's gone into the first 4 years of this grand adventure has been immense, in many ways immeasurable, and I think above all admirable, and a true testament to your commitment to transformation for our communities. And now, as we move into the 5th year of this grand adventure, we recognize it as probably the hardest year so far, a year of stretching to the goal line. However, I have seen the sheer power of commitment and collective will demonstrated by the people in this room and people outside of this room that don't happen to be with us today, but are still part of this grand adventure. And I have absolute faith in each and every one of you and in our collective ability to reach that goal line, to achieve our vision of an integrated, cost-effective health system that supports the most vulnerable members of our communities. And I'm so grateful to be part of this journey with you. It's been quite the ride, and it's been a lot of fun. And I get to say that because I get to watch all the great work you're doing and applaud it, and I'm not sitting in your chair. And I'm looking directly at Sarah Cook and Katie Coburn and all the folks that I know have just been living this day, night, breathing it, eating it, sleeping it, I'm sure. And it's tremendous what you've done. I get to introduce Senator Watson now. I don't know if I really need to introduce you because everybody knows who you are, but you are our leader in healthcare transformation. It's pretty amazing to think we're coming up on the 4-year anniversary of the announcement of your 10 in 10 vision. So we are so glad that you're here with us today and talk with us and celebrate what we've been up to.
Thank you.
Thanks.
Yeah. Great. Thank you. Thank you, Trish. Well, I'm not going to give a big old long speech. At least I don't feel like I am right now. And Trish, is this your phone? It's mine. Okay. Well, no wonder you don't tweet. You don't keep your phone with you. Somebody will panic a little later. What I want to do is just 2 or 3 things. Trish just hit on a couple of things that I think are important. One is we are talking kind of anniversaries. When you stop and think about it, we're now in September, which, by the way, means football season, and it gets me excited, although this TCU color for this Baylor guy on my little badge is kind of hurting me today. But other than that, I'm feeling pretty good. No, but the truth of the matter is it's September. And 4 years ago in September, we laid out a broad vision for this community. And that broad vision included 10 goals in 10 years. And it was also in correspondence with the 1115 Medicaid transformation waiver. And so now we're on an anniversary of that. And the truth of the matter is, as I stand in front of you today, as someone who is extraordinarily passionate about health care and how we go about doing it, I can say that I am hearing all over the state about the work that you are doing right here in your communities that is extraordinarily creative and importantly, and Trish touched on this, importantly, focused on the patient. It is healthcare that is recognizing the humanity of who it is that we serve. So 4 years down the road, and I was with you last year, but 4 years down the road, I can say to you, as someone who cares about this, who pays attention to it, and who watches what it is that's going on, you are making specific differences in individual human lives. And that is a wonderful public service. And something that I want to say to you from my deepest soul, thank you, and God bless you. In this day and age, where it's so easy to politicize every little thing and to find enemies or someone doing something wrong. In fact, that's the way we're supposed to play this game, it seems. You are doing it the right way. No one's the enemy. Everyone is the patient and has dignity. And your creative ways of achieving help is making a difference in people's lives. So, thank you. But the future scares us all, and legitimately so. It ought to scare us for a couple of reasons. One is it ought to scare us because as you're building on success and you're doing those things that you experiment with, there will be times that they don't always work. There will be times that someone will politicize it. There will be times that someone will come out and say, well, that's a waste of money because if you'd have done it a different way, it would have resulted in this result. I encourage you not to become paralyzed by the fear of a better idea coming along or the fear of failing in some way, because it's the innovation that this all was intended to bring about. And there are times when innovation just doesn't work out the way we hoped. But if we learn from it, and we all learn from each other's experiences at events like this, then what happens is we're better the next time when we innovate. And I got to tell you, the fear of the better idea coming along, particularly in medicine and healthcare, that happens all the time, right? Well, that's a pretty good idea, and that would be something good, but what happens if a week from now, a month from now, a year from now, somebody comes up with a better idea? And so everybody gets paralyzed, and they don't move. Well, you can't do that in what you're doing. First of all, we got to move too fast. We got to be creative. We got to be nimble. But the other thing is, it just doesn't work. It doesn't help. It doesn't help cure a single patient if we don't go forward with an idea. It doesn't help prevent illness in a single patient if we don't go forward with an idea. Now, I'm going to be honest. I live by that creed. Don't be paralyzed by fear of the better idea coming along. Some of you will say, yeah, you sure don't seem to care what the other better ideas are. But I live by it because I learned it at a very early age. My wife and I have been married 36 years. We started dating when I was 14. So technically I've been married more than 36 years, or at least I've been told what to do for longer than 36 years. But you know, when at first she wouldn't go out with me. I remember it very vividly. 1973, Boswell High School, Saginaw, Texas, homecoming. I walked up to Liz McDaniel and I said, will you go to homecoming with me? And she said, no. I'm waiting for someone else to ask me. Yeah, I was right. And they're getting ready to pull the hook on me, so we don't have near enough time to talk about how bitchy that is. and I'm obviously over it. But here was the life lesson. The girl was waiting for the better deal to come along, and it didn't. My point to you is you guys are in the job. It's the perfect deal for somebody that cares about humans. It's the perfect deal for someone that cares about making sure those humans can enjoy as much of life as they are capable. It is the perfect job because it allows you to help them achieve those goals and do it in creative ways. So I encourage you to keep doing that. And don't fear the critics. Don't fear the nitpickers, the naysayers, and the know-it-alls. You are on the front lines of enhancing human capacity. So keep it up. You're going to hear from people today about all sorts of successes, and I know a bunch of them. I don't know them all, but I know a bunch of them. I couldn't be prouder. I couldn't be prouder to be in a position to get to share some of that fun with you. You're going to also hear about the future of the 1115 Medicaid transformation waiver. And I will tell you, I'm hopeful. It's going to be painful. It's going to be ugly. And there's going to be a lot of politics. But if we can set just some of the politics aside, I think we can get to a good place. My hope, frankly, is I'm not sure I even, and I'll say this carefully, I'm not sure I even want to see us try to get a renewal right now, because I worry about what a renewal would really look like and what sort of haircut we might get. But I do think giving us an extension and working to get an extension of time for some reasonable period of time while we work on a renewal and we work on details of the renewal, I think that is probably a really good course, and I see hope in that. So you'll hear more about that, and you'll hear people that are involved in the intricacies and details of that later today. I've taken too much time, but I just can't waste the opportunity to tell you how proud I am and how thankful I am that we have people in Texas that care as deeply as you do. God bless you all. Thank you for your wonderful work.
Thank you, Senator Watson. Thank you, Trish. Really appreciate your leadership here in this 1115 waiver. I know we all feel your support. Thank you.